Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have a very special guest. He is an author who has written several books and publications about ADHD, and he has a very strong focus on some of the unique challenges of ADHD and how it affects people as well as their families. And so we are very delighted today to introduce Dr. James Greenblatt.
Thank you. It's good to be part of your show.
Yes, sir. Thank you so much for making time. I know you have a very busy schedule. Tell us a little bit about the work you do currently and sort of your background in ADHD.
Sure. I'm a traditionally trained physician, psychiatrist, child psychiatrist. But one of the common concerns we have in mental health treatment across all diagnoses, depression, and in particular ADHD, is our medications have only limited value and often have side effects. So the field that I've been part of for many years we call it integrative psychiatry. So we integrate traditional treatments, which for ADHD is primarily medications, with nutrition or metabolic understanding that can either support medicines or oftentimes be used in place of medicines.
Interesting. Very good. And tell us a little bit about ADHD itself. So many people hear about it on the news or from their doctors. What is your definition of ADHD? How would you explain that to someone?
Well, I think one of the most important things I can say is it's not a behavior disorder. It's not kids trying to act poorly. It is, I would say, a medical disorder with a neurobiological basis. So the brain is such with a genetic vulnerability where it's hard to control impulses, so impulse control, poor attention. We can look at brain waves in different parts of the brain that's not working optimally, so attention or persistence of effort is impaired. And for the younger kids, it's more hyperactivity, overactivity. As we get older, adolescents, adults, is more an internal sense of restlessness. So clear behavioral symptoms, but driven by a neurobiology.
I see. Very good. And I'm an ER doctor, so typically I will see a large spectrum of people who come in. Many people have a diagnosis of ADHD, and as you mentioned, they're very impulsive. So it's hard for them to sit still just for us to get a blood pressure. It's difficult for us to draw labs or even to do x-rays on them. And I would have to say that the incidence of ADHD is increasing. Is that something that you have also noticed in your practice?
Clearly, certainly. We have good statistics on medication usage, which is increasing quite dramatically in this country for both kids and adults. The fastest growing population is adult women who are taking stimulants, but the diagnosis does appear to be increasing and certainly diagnosing at younger ages.
I understand. Very good. And then tell us a little bit about some of the information that you have researched. So tell us about what an integrative psychiatrist does on a day-to-day basis.
Sure. I mean, we would do a typical evaluation, helping parents understand the diagnosis. Is it ADHD? Is it a medical problem? Is it a behavior problem? And rather than just quickly writing a prescription for amphetamines, the stimulants, we would look and see if there are nutritional deficiencies. Iron deficiency is common. Magnesium deficiency is also very common. So we would kind of do a more holistic evaluation, either with starting medications or for parents that want to hold off on medicines before medicines are initiated.
I understand. Very good. And then in your book, which is called Finally Focused, this is listed on Amazon and many other websites, you talked about several different factors. And some of the things that you also mentioned are a plan that you call the plus-minus plan. Can you tell us a little bit more about that formula?
Sure. I mean, I think in medicine we tend to have a drug that treats let's say, depression, and we have symptomatic-based care in psychiatry. And what integrative psychiatry does is really look, is there an underlying cause? And for ADHD, there could be many. And so the plus-minus plan is just a mnemonic that we help parents and physicians begin to kind of ask the question, is there something that the child needs, which means we need to add it, or minus, is there something that might be contributing? So we go through a list of nutrients. So the pluses would be things like magnesium, other kind of nutrients, higher protein food, less refined sugar. And then the minuses would be looking for underlying GI problems, lead, copper. Got a lot of press with lead in Flint, Michigan. It is probably the most common heavy metal contributing to ADHD. So the plus minus is really just a mnemonic, a guide as to what we might add and what we might need to subtract.
Interesting. Very good. I've not heard of it described that way before, so I was very fascinated that there's an environmental component to ADHD, and I think there will be a lot of research focused on that because, as you mentioned, there seem to be multifactorial causes for why so many people are now afflicted with it. Now, have you traveled abroad? Have you seen in Europe or Asia a similar trend where more people are being diagnosed with ADHD, or is this more unique to the United States?
Well, clearly the diagnoses and the use of stimulants are much less around the world, but they're growing, and it's sadly pretty much based on when the pharmaceuticals arrive. But clearly, Britain and France in particular have very low rates and much lower medication rates.
I understand. Very good. And then give us a time frame. So if people or their families decide to go with the plus-minus plan for ADHD, what is an expected time frame where people can expect to see results from that?
Great question. We're all looking for the quick fix, and sometimes a medication for ADHD can improve behavior, in a week or two. The nutritional approach, getting at some of the foundation work, is usually at least 3 months. 3 to 6 months. And in addition to sometimes being able to avoid medication, I think one of the most important things I can share with your listeners is a nutritional intervention can help minimize the side effects of medications.
I see. Very good. And then I know a lot of people that take ADHD medications, it almost suppresses their appetite. And a lot of parents will bring in their very young children, maybe 6 or 7 or 8 years old. And I think they have almost a weight loss that goes with it when they start treatment. They seem to do better in school, but they actually lose weight. Is that something that you have also seen consistently?
Yeah, it's quite a concern, particularly since a lot of my work is with anorexia and eating disorders. So the side effects of stimulants that are hard to treat would be decreased appetite and insomnia. So the other side effects like irritability can be treated with adjusting the dose or adding magnesium. The appetite, if appetite is a problem, oftentimes we'd want to switch to a different stimulant, but if it persists, you really need to work with a pediatrician because weight loss in a developing child or adolescent is not healthy, and we've seen it trigger anorexia, an eating disorder.
I understand. Yes, no, I agree with you. And as I said, in the ER, we're usually focused on things like car accidents and broken bones and things like that. But we can't ignore their condition, because we have to be aware of what medicines they're taking at home and how anything we prescribe can actually interact with it as well. So I'm glad that you mentioned that. It does require the pediatrician or the family doctor to kind of be the leader, if you will, to kind of oversee and minimize any adverse effects as well. Now, tell us in the future, after you've published this book, do you have other publications or other books that will be available soon?
Sure. I mean, the work that I do as an integrative psychiatrist, and I've been practicing 30 years now, we're slowly trying to reach most of the major psychiatric illnesses. We have books on anorexia, binge eating disorder, and the most recent publication for next month will be on Alzheimer's, nutritional interventions for the prevention of Alzheimer's.
Excellent. Very good. And those of you just joining us now, I've been speaking with Dr. James Greenblatt. He is a professor. He is a licensed physician. He is a well-published author, and he talked today about a lot of the ADHD challenges along with treatments and the nutritional component, which is becoming a major focus, especially in prevention of the development of these symptoms. Dr. Greenblatt, tell us some final thoughts. What are some final words that you can advise our listeners who already have ADHD or struggling with it? What are some of the things that you can tell them to remain positive?
Well, I think back to the first word, integrative. I think for those parents frightened of medications, I would urge them to work with a professional, because medicines aren't evil. They can be incredibly helpful and set a child on a course. But medicines by themselves might not be sufficient. And looking at underlying nutritional, the most common nutrient would be to understand magnesium as a supplement for ADHD. So working with professionals and not blaming your child for these behaviors, understanding it as a medical neurobiological disorder, will result in a much more kind of cooperative communication with you and your child.
Excellent. Very good. No, I think those are very wise words, and I'm sure all of us can benefit from that. A little extra patience and a little more understanding for this very, very challenging condition, certainly. Well, thank you so much, Dr. Greenblatt. You've been very, very knowledgeable on this subject, and once we get this out there, I'm sure there will be a lot of feedback from our listeners. Is it okay if I send you some questions if they should connect with us on social media?
Absolutely. Yes, appreciate the opportunity, and thank you for your work.
Yes, sir. Very good. And those of us, who are ER doctors or just family practice doctors, we rely heavily on psychiatry and some of the other related specialties to manage ADHD. So thank you again so much for making time to speak with us today.
Great. My pleasure.
Yes, sir. And now what we'll do, those of you listening to Simple Health Radio, we will transcribe this episode and we'll also convert it into a blog so that you can get the links to download Finally Focused, which is the book that Dr. James Greenblatt has published. If you have any other thoughts or questions, connect with us on social media. We are available on Twitter, Facebook, Instagram, and Pinterest, and I look forward to having you all on a future episode.